Thank you very much. I am Henry Waxman, Chairman of the Energy and Commerce Committee, and I'm pleased to join with my colleagues in our respective committees that will have jurisdiction over this health care matter in presenting a draft proposal from which we would seek further comment by the public and our colleagues as we fashion the legislation. The draft is a very practical one, and it's a uniquely American proposal. It builds on what works and fixes what needs to be fixed. First, we encourage the retention of insurance provided by employers, which is the way most people have their insurance. In other words, as the President has said on many occasions, if you have insurance and you like it, you get to keep it. Secondly, we're going to address difficulties individuals and small businesses face in the current market. Today, people can't get coverage if they have a pre-existing medical condition. Secondly, too many people are charged higher premiums, even if they can get insurance, because of their health status. And small businesses go into a completely dysfunctional insurance market when they try to get insurance for their employees or even for their loved ones. The market's dysfunctional and they face unaffordable rate increases. That kind of discrimination will end. Third, people who don't have employment-based insurance or who change their jobs will always have access to affordable coverage, and they can take it with them wherever they may go, from one job to another. Even if they're out of work, that insurance will be there for them. With that coverage, they'll have the protection from the catastrophic costs that is faced by many who need care and don't have coverage. Choice is the key. Choice is the key for consumers to pick which plan they want, whether it's a private insurance plan or a public insurance plan. Choice is important for patients to be able to pick their own doctors. Fourthly, we're taking comprehensive action to make sure that everyone gets more value for their health care spending. We're moving to get costs under control through payment improvements and delivery reforms. And we're taking a number of steps to improve quality and reduce ethnic and racial disparities. And under this proposal, at least 95% of Americans will be covered, which helps us proceed on both the cost and the quality front. Fifth, we're improving Medicare. People who have Medicare will have that available to them, and they'll even have a better Medicare system. We're going to take substantial steps to phase out the donut hole, that so-called donut hole that people face when their pharmaceutical costs are too great. And we're going to address one of the major concerns of physicians around this country, and that is that we are going to permanently reform the unfair physician payment cuts under current law. We're going to fix the sustainable growth rate, or the SGR. Six, we're making major investments in the workforce, making sure that physicians and nurses and other health providers are available to meet patients' needs. And there is an even stronger network of community health centers that will be available as well. And finally, we're going to enhance prevention and wellness programs. They're absolutely essential to a true health care reform. So we're assuring coverage of preventive benefits and investing in major community prevention initiatives. We are now ready to proceed. This legislation, and I want to stress it, is important for the health and the financial security of all Americans. We're going to seek helpful input from our colleagues, from citizens, from interest groups. We're going to hold the hearings starting next week, and we're going to keep on the schedule that the President set out for us. We are going to be proceeding to figure out a final proposal to present to the House of Representatives by the end of July. Let me be clear, the time to act is now. The one choice we can't make is to just delay because the status quo is unacceptable. We can keep the status quo or we can move to a new system. And this new system will be based on the vision of President Obama, the vision he set out in his campaign, the vision for which he had a mandate to move forward, and the vision for which we stand ready to be of assistance to him.